I'd like to welcome you all to our eTCP learning event. Thank you very much for coming. My name is Andy Shakeshaft from the Innovation Agency Academic Health Science Network for the North West Coast. I'd like to thank you first of all on behalf of the Innovation Agency and NHS England who are sponsoring the event for taking your time and for coming this evening, and your support is very much appreciated. This is a very exciting programme, a genuine partnership between NHS England, the Innovation Agency, the local pharmaceutical networks and committees, Liverpool John Moores University, the University of Manchester, and of course, the pharmacy community. I think we're in for a great evening tonight. We've got some fantastic speakers. We've got Hassan Argomandkhah, Chair of the local pharmaceutical network for Merseyside. He's going to speak to us about the strategic perspective of electronic transfers of care. Chris Green, Chief Pharmacist from the Countess of Chester Hospital, is going to speak to us about the hospital perspective of transfers of care. We've got Matt Harvey, he's the Chief Executive of the LPC for Liverpool. He's going to take us through a practical demonstration of what those transfers look like for you. And then following that, we've got Sarah Goff. She's going to take us through some practical examples to make it real for us. Annie Roberts is going to speak to us about how we're going to communicate together, what the website looks like and the resources available, newsletters, etc., etc. So I think we're in for a great night. Following that, we're going to have a Q&A session and then another opportunity for networking. So we'll be able to speak again. We should have you away for around 9:30. There's no planned fire alarms this evening, so if you do hear the bell, it's probably a real fire. So you can go back out through the reception or back through the room. There's two doors on either side. We muster over the bridge where you came in. The toilet's just outside for those who've not seen them. And if I could ask, if you could turn your phones to silent now, please, to avoid interrupting the speakers, I'd be really grateful. So, sit back, relax, enjoy the evening, and I'd like to hand over to our first speaker, Hassan Argomandkhah. Thank you.
Thanks, Andy. Right. Those of you who are here now, any of you know what you're here for? Hands up if you do. Very good. Very, very good. Right, okay. This is, I feel like a midwife tonight. I'm delivering a baby, eTCP. It's not a very nice name. I mean, you know, I'm sure there are more sexier names to give a child, but eTCP it is. We've been working on this project for a year now. It came out of a collaboration we wanted to do with our hospital colleagues and connecting them with our community pharmacy colleagues. Because in the middle of all this, there is somebody called Mary, who is a patient, who attends a hospital, leaves the hospital, but not necessarily knows what's going to happen with the care they're going to receive once they are out of hospital. So this is our Mary going in and out of hospital. The community pharmacy is isolated. After discharge, the medical colleagues get the information from the hospital about the changes to the medication, anything started, why they got admitted to the hospital, etc., etc. But community pharmacies very often have to pick up the pieces, especially if the Mary gets discharged on a Friday afternoon at 4 o'clock. Yeah? How many of you have been there? Yeah? 4 o'clock, Mary comes out. Just before you put the shutter down at 6:30, Mary's son arrives. I need my mom's tablets. So that's why we want to launch electronic transfer of care. Because without that information, you have cat in hell chance of helping Mary. Unless Mary comes, or the son comes armed with a copy of a discharge. So what we did was, to make sure that we can launch this program, we started going right to the top of the chain in terms of NHS hierarchy in Cheshire and Merseyside. And that's, some of you must have heard about STPs. Yeah? There used to be an oil STP. Do you remember? Any of you old enough? Used to pour it in the car to stop it smoking. But this is not the same STP. This is Sustainability Transformation Plan, which is the overall arching body to make sure all the NHS organizations, all the care providers in Cheshire and Merseyside work together for a common goal of making sure Mary and people like Mary are well looked after in Cheshire and Merseyside. Some of the targets eTCP would address are highlighted there, right? Reducing emergency bed days, hospital readmissions, drug waste, etc., etc. Okay? So we managed to get some funding together. And the key objective we had was to have a fully integrated system. Because what's important is that we understand our hospital colleagues, like Chris and his team, are super busy. They just about managed to get the day job done. So to give an extra burden of having to ring the community pharmacy, which they do at the moment. Most of you have had a phone call from a hospital pharmacy. They want to send you a fax because Mary is in hospital, send you and trying to find that. Takes them 10 phone calls to get the right person in the community pharmacy. You find something, a mistake, and you have to try to find the right person in hospital, etc., etc. So that communication is really glitchy. So we wanted to come up with a solution that's fully integrated, makes it business as usual for the hospital pharmacy team, and makes the work in the community pharmacy as business as usual. So that's why we've got the program put together. Okay? This is what we would like to happen. Okay? On this chart, the hospital pharmacy team identifies this patient is at risk because there has been some changes to the medication, new medicines started, some old ones that maybe caused the admission has been withdrawn. Examples of the sort of things those patients, vulnerable patients are. And the message goes to community pharmacy, who then refuse this information. And if they've got any prescriptions there that could be sitting there with the wrong medication, they could intervene, make sure that Mary's son doesn't collect that, and deal with the GP to make sure the correct prescription comes back. We are hoping also to provide some additional support in the first year to make sure that the community pharmacy colleagues and the hospital colleagues are able to make sure that the messaging, all the little glitches in the system are removed so that we can support you in the first year. The discharge information still goes to the practices. Okay? So remember that first picture, and that's what we're trying to do now. We're trying to get all these connections between the hospital, community pharmacy, support for community pharmacy, to make sure you have access to the timely information to make the right intervention for those patients. Okay? These are some of the benefits when we consulted the patient groups, the hospital groups, community pharmacy teams, GP practices, NHS bodies like CCGs and social care. These are the list of benefits to each one of those. And you know, when we talked, the key one was when we talked to patients, none of the patients we talked to actually thought, doesn't this happen? And it is. You ask the patients think that everybody in NHS talking together, we're one big happy family. We are. All of you are smiling, aren't you? Very good. Right answer. So we're all happy family, but we need to make sure that we also go to each other's houses and buy each other a round of drinks now and again, yeah? So this is important, that what we are trying to do is getting you all connected, talking to each other. Because it's only through talking and passing the information through the right channels we can provide the best care. Okay? And the sort of things we are doing is that because of the enormity of this project, originally we were going to do just one hospital. But when we got some funding, we put it in one of those rollers and flattened it and stretched it as much as we can to see if we could, why do just one hospital? We'll try to do it across the whole of Cheshire and Merseyside, 12 hospitals. Yeah? So this is why tonight is such an important event. Because tonight, Chris's hospital, which is Countess of Chester, is the first baby getting delivered. Yeah? It's a very naughty baby, by the way. I'm glad you said just 3 months. Okay, so this is where we are. Leighton Hospital, which is in South Cheshire near Crewe. is the next hospital hoping to go live. But all the other 10 hospitals on there are somewhere along the path. And we got 2 people from Northwest Boroughs and, where are you, Jasmine? Oh yeah, there you go. This one, the Cheshire and Wirral Partnership and Northwest Boroughs, they are almost there to go live sometimes in November, we hope. Okay, and the rest of them are in the process. So when we go live fully across all 12, you will be getting regular communications from all these hospitals when Mary goes in and out of hospital with the changes, with the sort of information you need to do your job properly. Okay? There has been research done by Nazar and Co. et al. Around the savings. But what we did was we used the same model and then we changed the savings in money to the number of bed days saved. And this is a very conservative estimate of saving over £3 million in Cheshire and Merseyside and over nearly 5,000 bed days in the hospitals across Cheshire and Merseyside. And that's it in a nutshell. Thank you very much.